Hello everyone, I am Dr. Renubala Rout. I am a practicing consultant gynecologist and infertility specialist. I practice at Lokhandwala, Kandivali East. So today again, once more with this video, I would be talking about a topic like what are the intimate or common gynec issues a female should never ignore. This is a very common, this topic would be very common because we'll be discussing about problems which I am very pretty sure that every female would have suffered once or the other time. So what are those symptoms? If I number them, menstrual irregularity is a very common symptom from the time menarche starts in a female till the time of menopause. One or the other times you would have definitely faced. So what is menstrual irregularity? A normal menstrual cycle is a cycle which is 24 to 35 days. So there are females coming to us which says that, madam, my cycle is delayed by 4 days. So what? Do not panic. Otherwise there are females which tells every mahine mere ko 5-6 din pehle aa raha hai. So what you do, make a calendar note and count from the first day of the present cycle to the first day of the next cycle. Count the days in between. If you find it anything shorter than 24 or 25 days or anything longer than the 35 days, then there can be some hormonal disturbance which is leading to this menstrual irregularity. So any short cycle, long cycle, scanty cycles, prolonged cycles. So what do you mean by scanty? What we feel generally the volume is 30 to 80 ml. The normal menstrual flow in a cycle which is normal. So anything less than 2 days is not supposed to be right, or anything which is beyond 7 days is not to be right, or any bleeding which is happening in between your menstrual cycle, day 10, day 18, day 16, that is not normal. Also when you are pregnant, any bleeding, that is not normal. Any menstruation which happens once you are already in your menopause. The menopause age can vary. These days we are seeing many cases of early menopause where the females are getting menopause around 40 or earlier than 40, much because of the environmental exposure, pollutions, the food we are eating, the lifestyle and all. We need to be careful on this. So any bleeding, that's for little females who are more than 50, that you had a menopause for a year, you were not menstruating, suddenly one day you see a vaginal spotting or bleeding, please do not ignore that and walk to your gynecologist. This could be a bigger underlying issues which the gynac need to tell you about. Now if you ask me, the other things which is very common is vaginal discharge. Vaginal discharge also, I would say, physiological is also possible and pathological. Physiological matlab, what I mean to say is thoda amount of discharge is always there in a female's life. You cannot be completely dry. If you are dry, that will give rise to infection. So we need our body, as we have a sweating, as we have a lacrimal gland which produce tears, we have vaginal glands which produce secretion in the form to keep our vagina moist and also protect us from outside pathogen entering our vagina. It gives lubrication during sexual activity. It keeps your vaginal health well so that you feel moist, you don't feel dry, you don't feel itchy. So some amount which is present normally is before you get your periods, around your ovulation date, you are about to get your periods, during sexual activity, and during the pregnancy part also there is a discharge which is more than the normal time. So any discharge, now this normal discharge do not have a smell, you don't have burning, irritation, pain while having sexual activity, you don't have. But if any of the normal discharge which I told you is more in amount, that it is giving you a wet feeling, your undergarments are making you feel wet, and there is a odor, there is burning, itching, the consistency of the discharge is thick, it is colorful like pinkish, reddish, greenish, grayish. So they are pathological, which makes it like there is an infection. That is why that is happening. So again, you have to walk to your gynac. Thirdly, if I tell urinary tract infection, I am pretty sure that every female probably once or the other time would have had this. So what is urinary tract infection? You get a sensation that you want to pass urine very, very frequently. You go to the washroom, you come back, next 5 minutes you again feel, oh, I want to again go to the washroom. So this is frequency of urination. Pain while you pass urine, there is a burning, there is an irritation which is making you uncomfortable. That is because of the bladder irritation, which is because of the infection in your bladder. So urinary tract infection quite common because females have a very short urethra and it is very easy for the bacteria to enter the urethra. So you have to drink sufficient water, avoid public toilets, and before and after sexual activity pass urine, and wash yourself, keep yourself dry and clean, and avoid public toilet usage. So this may be a short treatment and prevention from urinary tract infection. You can also have cranberry juice, which is, I would say, rather than cranberry juice and adding sugars, drink a lot of water, 2.5 to 3 liters daily, because all the toxins of our body go out through water, through kidneys, through urine. So drink a lot of water, at least 2.5 to 3 a day. The next thing I would like to mention is a breast lump. So again, breast lump, some of the lumps which I have seen young girls as young as 12, 14 years, they complains of feeling something hard which is painful when they are developing the breasts. Also above 20, 25, in the active reproductive age group, females have a feeling that they have a lump. Now this lump, how do you do? So the breast cancer and the cervical cancers in females, and being in India, are very, very common. So at least I want to make you aware through this video that you can do a self breast examination. There's an inspection and palpation. Stand in front of the mirror, try to palpate around the breast, look at the nipples, look at the breast positioning, the skin condition, the hanging over, and see if there is a deformity. While palpating, you have to see if there is a discharge. The discharge, while if you are not lactating, is not normal. So if you are not lactating and having a discharge, it is abnormal. Secondly, if you feel lump, now these lumps can be benign or cancerous. Most of the lumps are benign, so don't panic. These are mostly called as fibroadenomas, which are the clumps formed because of the hormonal things, the glands come together, So do not panic, check yourself, walk to the doctor. We have treatment, medical treatment for them sometimes, but if they are big, painful, they are not cancerous, but still we can remove to make you feel comfortable, but then some lumps are cancerous, which we come to know through biopsy, and they have a different treatment. So be careful, be knowledgeable, and be informed about any breast lump, breast discharge at the right time, and walk to the doctor if you have any doubt on your mind. Secondly, I would call cervical cancer awareness. I would like to give you that what can you do to prevent. See, we are very prone to any cancers are very much increasing now in India, and the responsible factors are our altered lifestyle, the environmental pollution, the food we eat. We don't sleep on time, we eat junk food, no healthy practices, and a lot of stress, uses of plastics and all. So we can't prevent all those from our life, but what we can do to prevent being with those things also. So one of them is preventing cervical cancer. Prevention is always better than the cure. Cervical cancer, we have seen cases as early as 20, 25 years too late, which is more common after the age of 45 or menopause, that a menopausal lady will suddenly tell that I'm having a discharge, serious discharge or vaginal discharge, which is excessive, or a blood-stained discharge or vaginal bleeding. That could be endometrial or uterine cancer or cervical cancer. But be aware, again, we have got the cervical cancer mostly is because of the papilloma virus, human papilloma virus. We have got many strains which cause that. This human papilloma virus can cause oral cancer, anal cancer, penile cancer, vulval cancer, warts, cervical cancer. So we can prevent all of these with vaccination. We have human papilloma virus vaccines available, which is is usually given between 9 to 45 year female. 9 to 14 year we have to give only 2 doses. Above 14 we have to give 3 doses. If you take this before sexual activity, it can give you up to 90-95 protection, which is very, very good to have. Don't be confident that if you have a single partner, you are very good with your hygiene, you may not have, because cancer don't choose, you know, they can happen with anyone. So again, I would say be informed and take the right step. You can go to the doctor as an annual health checkup, do pap smear, do liquid-based cytology, and so that's what you can do. And at the last, I would say eat healthy, and mental stress, mental issues is very common again in females, because we are multi-workers. We have to handle home, we have to handle the child, we have to handle career. So even I would say that is not to be neglected. You know, you need to talk about your mental status to your colleagues and family also. So I think I am completing this topic very reasonably fair enough to give you a brief idea on most of the things what we undergo. Thank you so much, and if you like this video, please like, subscribe or comment below. Any further questions you can put it in the comment and we will be happy to answer you. Thank you.